High blood pressure, also known as hypertension, is a common condition that affects millions of people worldwide. Managing it often requires prescription medications, but many people also turn to over-the-counter, or OTC, medicines for other health issues. However, not all OTC medicines are safe for those with high blood pressure. In this video, we'll explore which OTC medicines are commonly used, which ones can affect blood pressure, and who should avoid them. Let's start by understanding why it's important to be cautious with OTC medications if you have high blood pressure. Many people assume that over-the-counter medicines are always safe because they don't require a prescription. However, some OTC drugs can raise your blood pressure or interfere with blood pressure medications. This is especially important for people who already have hypertension or are at risk. Even common remedies for colds, pain, or allergies can have hidden risks. That's why it's crucial to know what you're taking and how it might affect your blood pressure. Let's look at some of the most common types of OTC medicines and how they relate to high blood pressure. Decongestants are commonly found in cold and flu remedies. Ingredients like pseudoephedrine and phenylephrine help relieve stuffy noses, but they can also constrict blood vessels, leading to increased blood pressure. For people with hypertension, this can be dangerous, potentially causing spikes that are hard to control. If you have high blood pressure, it's best to avoid decongestants or talk to your doctor before using them. Instead, look for alternative remedies that don't contain these ingredients. Non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and naproxen, are popular for treating pain and inflammation. However, these medications can cause your body to retain sodium and water, which may increase blood pressure. They can also reduce the effectiveness of some blood pressure medications. If you have high blood pressure, use NSAIDs with caution and only as directed by your healthcare provider. Acetaminophen is often a safer alternative for pain relief in people with hypertension. Acetaminophen, also known as paracetamol, is commonly used to relieve pain and reduce fever. Unlike NSAIDs, acetaminophen does not typically raise blood pressure or interfere with blood pressure medications. For people with hypertension, acetaminophen is usually considered a safer option for managing mild to moderate pain. However, it's still important to use it as directed and avoid exceeding the recommended dose, as high doses can harm your liver. Many cough and cold remedies contain a mix of ingredients, including decongestants, antihistamines, and pain relievers. Some of these, especially decongestants, can raise blood pressure. Always check the label for ingredients like pseudoephedrine or phenylephrine. If you have high blood pressure, choose products labeled as decongestant-free, or consult your pharmacist for safer alternatives. Remember, even herbal remedies and supplements can sometimes affect blood pressure. Antihistamines are used to treat allergies and are generally considered safe for people with high blood pressure. However, some combination products may include decongestants, which can be problematic. Always read the label carefully and choose plain antihistamines if you have hypertension. If you're unsure, ask your healthcare provider or pharmacist for advice on which allergy medications are safest for you. Herbal supplements are often marketed as natural remedies, but they can still affect your blood pressure. Some herbs, like licorice root, ephedra, and ginseng, can raise blood pressure or interact with blood pressure medications. Always inform your doctor about any supplements you're taking, and be cautious with products that make bold health claims. Natural doesn't always mean safe, especially for those with hypertension. People with high blood pressure, heart disease, kidney problems, or those taking blood pressure medications should be especially careful with OTC medicines. Certain groups, such as older adults, pregnant women, and those with multiple health conditions, may be at higher risk for complications. If you fall into any of these categories, always consult your healthcare provider before starting any new OTC medication or supplement. One of the most important steps you can take is to read OTC medicine labels carefully. Look for active ingredients, warnings, and any statements about blood pressure. Some products may have a heart symbol or a warning for people with hypertension. If you're unsure about an ingredient, ask your pharmacist or healthcare provider for clarification. Being proactive about label reading can help you avoid unwanted side effects. Pharmacists are a valuable resource when it comes to choosing safe OTC medications. They can help you identify which products are safe for people with high blood pressure and which ones to avoid. Don't hesitate to ask your pharmacist for recommendations, especially if you're dealing with multiple health conditions or taking several medications. Their expertise can help you make safer choices. Many OTC products combine several active ingredients to treat multiple symptoms at once. While convenient, these combination medications can increase the risk of side effects, especially for people with high blood pressure. Always check the label for decongestants, NSAIDs, or other ingredients that may affect your blood pressure. When possible, choose single-ingredient products to minimize risk. Caffeine is sometimes added to OTC pain relievers and cold medicines to enhance their effects. However, caffeine can temporarily raise blood pressure, especially in people who are sensitive to it or already have hypertension. Be mindful of your total caffeine intake from all sources, including coffee, tea, and OTC products. If you have high blood pressure, consider choosing caffeine-free options. Some antacids contain sodium bicarbonate, which can increase sodium levels in your body and potentially raise blood pressure. If you need an antacid, look for low sodium or sodium-free options. Always check the label and talk to your healthcare provider if you're unsure which product is best for you. Managing sodium intake is an important part of controlling high blood pressure. Most laxatives are safe for people with high blood pressure, but some, especially those containing sodium, can affect your blood pressure. Bulk-forming and stool softener types are generally considered safe. However, always use laxatives as directed and avoid overuse, as this can lead to dehydration or electrolyte imbalances, which may impact blood pressure control. Many weight loss supplements contain stimulants like caffeine, ephedra, or other herbal ingredients that can raise blood pressure and heart rate. These products are not recommended for people with hypertension or heart problems. Always be cautious with weight loss products and discuss any plans to use them with your healthcare provider. Remember, there are no shortcuts to safe and effective weight management. Energy drinks are sometimes marketed as dietary supplements and can be found alongside OTC products. They often contain high levels of caffeine and other stimulants, which can significantly raise blood pressure and heart rate. People with hypertension should avoid energy drinks and be cautious with any OTC products that promise increased energy or alertness. Some OTC sleep aids contain antihistamines, which are generally safe for people with high blood pressure. However, combination products or those containing alcohol can have unwanted effects. Always check the label and avoid products with multiple active ingredients. If you have trouble sleeping, talk to your healthcare provider about the safest options for you. Allergy medications are widely used, especially during certain seasons. As mentioned earlier, plain antihistamines are usually safe for people with high blood pressure. However, always avoid allergy medications that include decongestants. If you're unsure, ask your pharmacist for help in choosing the right product for your needs. During cold and flu season, it's tempting to reach for multi-symptom OTC remedies. However, these often contain decongestants or NSAIDs that can raise blood pressure. Instead, focus on rest, hydration, and single-ingredient products that are safe for people with hypertension. Always check with your healthcare provider if you're unsure about a product. Pain is a common reason for using OTC medications. For people with high blood pressure, acetaminophen is generally the safest choice for mild to moderate pain. Avoid NSAIDs unless your healthcare provider says otherwise. Always use the lowest effective dose for the shortest possible time to minimize risks. If you have high blood pressure and need to take an OTC medication, it's a good idea to monitor your blood pressure more closely. Keep a log of your readings and note any changes after starting a new medicine. If you notice a significant increase in your blood pressure, stop the medication and contact your healthcare provider right away. Some OTC medicines can interact with prescription blood pressure medications, reducing their effectiveness or causing side effects. NSAIDs, decongestants, and certain supplements are the most common culprits. Always inform your healthcare provider about all the medications and supplements you're taking to avoid dangerous interactions. Alcohol can interact with many OTC medicines, sometimes increasing the risk of side effects or raising blood pressure. If you have high blood pressure, it's best to limit alcohol intake and avoid mixing it with OTC medications, unless your healthcare provider says it's safe. Always read labels for warnings about alcohol interactions. If you have high blood pressure and experience new or worsening symptoms after taking an OTC medicine, seek medical advice promptly. Symptoms like severe headache, chest pain, shortness of breath, or sudden changes in blood pressure require immediate attention. Don't ignore warning signs. Your health and safety come first. While high blood pressure is less common in children, it can still occur. OTC medicines for children should be chosen with extra care, especially if the child has a history of hypertension or heart problems. Always consult a pediatrician before giving any OTC medication to a child with high blood pressure. Older adults are more likely to have high blood pressure and take multiple medications. This increases the risk of drug interactions and side effects from OTC medicines. Always review all medications with your healthcare provider and pharmacist to ensure safety. Adjustments may be needed to avoid complications. Pregnant women with high blood pressure need to be especially careful with OTC medicines. Some medications can harm the developing baby or worsen blood pressure control. Always consult your obstetrician before taking any OTC medicine or supplement during pregnancy. People with kidney disease often have high blood pressure and must be cautious with OTC medicines. NSAIDs and certain antacids can worsen kidney function and raise blood pressure. Always consult your nephrologist or healthcare provider before using any OTC products if you have kidney disease. If you have heart disease, choosing the right OTC medicine is crucial. Many products, especially those with decongestants or NSAIDs, can worsen heart conditions or raise blood pressure. Always check with your cardiologist or healthcare provider before using any new OTC medication. While OTC medicines can help manage symptoms, lifestyle changes are the foundation of blood pressure control. Eating a healthy diet, exercising regularly, reducing sodium intake, and managing stress all play important roles. These habits can reduce your reliance on medications and improve your overall health. It's a good idea to keep an up-to-date list of all your medications, including OTC products and supplements. Share this list with your healthcare provider and pharmacist at every visit. This helps prevent dangerous interactions and ensures you're using the safest options for your health. Travel can disrupt your routine and make it harder to manage high blood pressure. Always pack your prescription and OTC medicines and keep them in their original containers. Check with your doctor before traveling to ensure you have enough medication and know which OTC products are safe to use if you get sick while away. In case of emergencies, it's important to have a supply of your prescription and OTC medicines. Keep a list of your medications and emergency contacts handy. Know which OTC products are safe for you and avoid those that could raise your blood pressure. Being prepared can help you manage your health during unexpected situations. There are many myths about OTC medicines, such as the belief that all are completely safe or that natural products can't cause harm. In reality, any medicine or supplement can have side effects or interact with other drugs. Always approach OTC products with the same caution as prescription medications, especially if you have high blood pressure. Hypertension, or high blood pressure, is a chronic medical condition where the force of the blood against artery walls is consistently too high. It often has no symptoms but can lead to serious health problems like heart disease, stroke, and kidney failure if left untreated. Managing hypertension involves lifestyle changes, prescription medications, and careful selection of OTC products to avoid complications. NSAIDs, or nonsteroidal anti-inflammatory drugs, are a class of medications used to reduce pain, inflammation, and fever. Common examples include ibuprofen and naproxen. While effective for many conditions, NSAIDs can increase blood pressure and interfere with blood pressure medications, making them a risky choice for people with hypertension. Decongestants are medications used to relieve nasal congestion, often found in cold and flu remedies. Common ingredients include pseudoephedrine and phenylephrine. These drugs work by narrowing blood vessels, which can raise blood pressure and pose risks for people with hypertension. Acetaminophen, also known as paracetamol, is a pain reliever and fever reducer. Unlike NSAIDs, it does not typically raise blood pressure or interfere with blood pressure medications, making it a safer choice for people with hypertension when used as directed. Antihistamines are medications used to treat allergy symptoms such as sneezing, itching, and runny nose. Most plain antihistamines are safe for people with high blood pressure, but combination products with decongestants should be avoided. Always check labels and consult your healthcare provider if you have concerns. Herbal supplements are products made from plants and used for various health reasons. Some, like licorice root and ephedra, can raise blood pressure or interact with medications. Always inform your healthcare provider about any supplements you use, as natural does not always mean safe. Blood pressure monitoring involves regularly measuring your blood pressure to track how well it's controlled. This is especially important when starting new medications, including OTC products. Keeping a log of your readings helps you and your healthcare provider make informed decisions about your treatment plan. Drug interactions occur when one medication affects the way another works, potentially causing side effects or reducing effectiveness. OTC medicines like NSAIDs, decongestants, and certain supplements can interact with blood pressure medications. Always inform your healthcare provider about all the products you use. Some OTC medicines, like certain antacids and laxatives, contain sodium. High sodium intake can raise blood pressure and make hypertension harder to control. Always check labels for sodium content and choose low sodium options when possible. To sum up, managing high blood pressure means being careful with all medications, including those you buy over the counter. Always read labels, avoid risky ingredients like decongestants and NSAIDs, and consult your healthcare provider or pharmacist if you're unsure. Remember, natural supplements can also pose risks. By staying informed and cautious, you can safely manage your blood pressure and overall health.